Well, thank you. We heard, earlier that, I cited that the BC First Nations Health Authority, the Canadian Association of Police Chiefs, our Chief Medical Health Officer of British Columbia, Dr. Bonnie Henry, the Chief Coroner of BC, the Expert Task Force on Substance Use, the former Chief Medical Health Officer, Perry Kendall, and Mark Tyndall, who have now been referred to as paid activists, that they're kind of, seemed like they're, by the Conservatives and by some witnesses that they bring, that they're alluding to some sort of conspiracy. Mr. Perrin, what do you think when you hear that all of these experts, or the question was brought earlier that they're not experts in addictions medicine? What do you think when they're deemed as unqualified, or that they wouldn't seek out expert advice when it comes to addictions medicine?
It's a shocking, unethical, and false allegation. I think when you're going to bring aspersions in a setting like this, where you're protected from criminal and civil liability, and you don't give anyone you're making allegations against an opportunity to respond, that's a very dangerous combination. I recently watched a podcast on McCarthyism, and it reminds me of that. You're going to start casting aspersions about people. There's a process and a way in which for the committee to explore any of those concerns they want, and it would, if they want to go down that road, which I don't think is necessary, they should be giving those people a chance to respond. There is a widespread consensus across different groups of people who work on this issue, including among addictions experts, that we need to address the root cause, which is this unregulated drug supply. So you mentioned the BC Coroner Service. I would encourage the committee to not just take that title, but when you look at the report that is the basis for the BC Coroner Service recommendation for regulated alternatives, I haven't even counted them. There's between 12 and 18 listed experts who are all work in this field, including addictions experts and physicians. So it's one thing to say someone disagrees, but to try to suggest that there's something else there is false and misleading and unethical. Ultimately, I would urge the committee, I guess, in closing, to say, please focus on the main concern here. You're studying why this is the leading cause of unnatural death for Canadians. And it's going to continue to go for a long, long, long time unless we begin to address the root causes of it, to do the emergency response now, to build the supports, the holistic supports around housing and addressing childhood trauma and prevention, all that. But we need to deal with the crisis we have urgently.